Pregnancy can be beautiful, but it can also be mentally and emotionally difficult. And when a pregnant woman is already dealing with depression, anxiety, bipolar disorder, trauma, OCD, or another mood disorder, pregnancy can make those symptoms stronger. This does not mean she is weak. It does not mean she is dramatic. It does not mean she is not grateful for the baby. It means her body, mind, hormones, sleep, stress level, medication plan, and physical comfort are all changing at the same time. And that is a lot for one person to carry. This is where the role of a partner becomes very important. A husband or partner cannot fix everything. He cannot remove every symptom. He cannot replace a doctor, therapist, or psychiatrist. But he can become one of the safest and most stabilizing people in her life. He can pay attention. He can listen. He can help her get support before things become a crisis. During pregnancy, hormones shift in powerful ways. Sleep may be worse. The body may hurt. Nausea, back pain, pelvic pressure, swelling, fatigue, heartburn, and fear about birth can wear someone down. On top of that, some women have to change or stop certain medications during pregnancy, and that can sometimes make depression, anxiety, or mood symptoms harder to manage. This is why mental health during pregnancy needs to be taken seriously. ACOG, which is the American College of Obstetricians and Gynecologists, recognizes depression, anxiety, bipolar disorder, suicidality, and psychosis as important perinatal mental health concerns that need screening, treatment, and follow-up. A partner should not assume this is just pregnancy hormones. Sometimes it is hormones. Sometimes it is exhaustion. Sometimes it is fear. Sometimes it is a mental health condition getting worse. And often, it is a combination of all of those things. So what can a partner actually do? First, believe her when she says she is struggling. Do not minimize it. Do not say you are just hormonal. Do not say other women go through this. Do not tell her she should be happy. Instead, say something like, I believe you. I can see this is hard. I am here with you. Let's figure out what support you need. That kind of response can lower shame. It tells her she does not have to hide how bad she feels. Second, help reduce her daily load. Pregnancy can make ordinary tasks feel enormous. A partner can help by taking over dishes, laundry, meals, grocery shopping, cleaning, errands, pet care, childcare, and phone calls when possible. This is not just being nice. This is mental health support. When someone is depressed or anxious, small responsibilities can pile up until they feel impossible. A partner who quietly takes some weight off her shoulders can help her nervous system calm down. Third, watch for changes that seem different from her usual personality. Look for signs like crying often, panic attacks, constant fear, not sleeping, even when she has the chance, sleeping too much, withdrawing from people, feeling hopeless, saying she feels like a burden, not eating, overeating, intense irritability, racing thoughts, impulsive behavior, or saying she cannot do this anymore. Also pay attention if she seems unusually energized with very little sleep, talks very fast, makes risky choices, seems disconnected from reality, hears or sees things others do not, or believes things that seem frightening or untrue. Those symptoms need urgent professional attention. Fourth, help her communicate with her OB. A pregnant woman should not have to carry mental health symptoms alone or wait until they become unbearable. Her OB should know if depression, anxiety, panic, mood swings, intrusive thoughts, insomnia, or worsening symptoms are happening. A partner can help by saying, let's write down what has been going on before your appointment, or would you like me to come with you so we can explain it together? Sometimes when someone is overwhelmed, they forget details during the appointment. A partner can help by gently documenting symptoms, how long they have been happening, whether they are getting worse, and whether medication changes happened recently. Fifth, support therapy and psychiatric care. Therapy can give her a safe place to process fear, trauma, relationship stress, body changes, birth anxiety, and the emotional weight of pregnancy. But therapy alone may not be enough for everyone. If she has a history of depression, anxiety, bipolar disorder, OCD, PTSD, psychosis, or severe mood symptoms, it can be very important to work with a knowledgeable prescriber or psychiatrist who understands pregnancy and postpartum mental health. Medication decisions during pregnancy should not be made out of fear, shame, or internet panic. They should be made with a qualified professional who can weigh the risks of medication against the risks of untreated mental illness. ACOG's guidance specifically addresses treatment and management of mental health conditions during pregnancy and postpartum, including psychiatric medication decisions. Sixth, help protect her sleep. Sleep is not a luxury during pregnancy. It is part of emotional stability. A partner can help by taking over evening tasks, encouraging a calm bedtime routine, reducing arguments at night, helping with pillows or comfort, handling older children in the morning when possible, and encouraging her to tell her doctor if insomnia is severe. Poor sleep can worsen anxiety, depression, irritability, and mood instability. For some mood disorders, especially bipolar disorder, sleep disruption can be a serious warning sign. Seventh, respond to intrusive thoughts with calm, not panic. Some pregnant women experience scary, unwanted thoughts. These thoughts can be about harm, danger, illness, birth, the baby, or something terrible happening. A partner should not shame her. He should not act like she is dangerous just because she is scared by a thought. Instead, he can say, "That sounds really frightening. I am glad you told me. Let's tell your therapist, OB, or psychiatrist so you are not carrying this alone." The key is whether the thoughts are unwanted and distressing, or whether she feels at risk of acting on them. If she feels unsafe, if she might hurt herself, or if she might hurt someone else, that becomes an emergency. Eighth, learn her warning signs before things get worse. Every person has patterns. Maybe she stops answering messages. Maybe she cries in the bathroom. Maybe she gets angry over small things. Maybe she says, "I feel numb." Maybe she stops caring for herself. Maybe she becomes terrified of being alone. Maybe she starts saying everyone would be better off without her. A partner can gently ask, "When your mental health starts getting worse, what are the first signs? What helps? What makes it worse? Who should we call?" That conversation is easier before a crisis. Ninth, do not make her manage his emotions about her symptoms. It is understandable for a partner to feel scared, helpless, frustrated, or tired, but he should not make her comfort him for being sick. Instead of saying, "I do not know what you want from me," try, "I may not fully understand, but I want to support you. Tell me what feels helpful right now." Instead of getting defensive, get curious. Instead of arguing with the symptom, support the person underneath it. 10th, know what to do in an emergency. If she talks about suicide, says she wants to die, says the baby would be better off without her, says she might hurt herself, says she might hurt the baby, seems disconnected from reality, is hallucinating, is extremely confused, or is acting in a way that feels unsafe, do not wait. Call 911 or go to the emergency room. In the United States, you can call or text 988 for immediate crisis support. Pregnant and postpartum people can also call or text the National Maternal Mental Health Hotline at 1-833-TLC-MAMA for free. Confidential support 24 hours a day. If there is immediate danger, do not leave her alone. Remove access to anything she could use to hurt herself. Stay calm. Speak gently. Get professional help right away. This is not betrayal. This is protection. This is love in action. A partner also needs to understand that pregnancy does not end the need for support. After birth, hormones shift again. Sleep often gets worse. Recovery can be painful. Feeding can be stressful. The emotional pressure can become even heavier. Mental health support should continue into the postpartum period. Postpartum Support International notes that perinatal depression and anxiety can affect both mothers and fathers, and that help is available. Their message is simple and important. People are not alone, they are not to blame, and with help, they can get well. The partner of a pregnant woman does not have to be perfect. He does not have to have every answer, but he does need to take her pain seriously. He needs to listen without dismissing. He needs to help with practical things. He needs to encourage treatment. He needs to know when symptoms are becoming dangerous, and he needs to remember that mental health care during pregnancy is not extra. It is part of prenatal care. A pregnant woman dealing with mental health issues needs more than reminders to stay positive. She needs safety. She needs patience. She needs medical support. She needs emotional support. She needs a partner who understands that love is not just saying, "I am here." Love is noticing. Love is helping. Love is calling the doctor. Love is staying calm during the hard moments. Love is learning what she needs, even when it is uncomfortable. And sometimes love is getting emergency help when she cannot protect herself alone. If your partner is pregnant and struggling, do not wait for things to become severe before you take action. Start with one honest sentence. I can see this is hard, and I want to help you get through it. That sentence will not fix everything, but it can open the door to support. And sometimes that is where healing begins. If this video helped you, please like it so it can reach more people who may need it. Subscribe for more gentle, practical conversations about mental health, relationships, pregnancy, and emotional support. And if you are going through this right now, please know this. Needing help does not make you a bad mother, a bad partner, or a weak person. It makes you human.